Three, two, one. Hi, everybody. So this is going to be on hydatiform mole or molar pregnancy. All right. This one will be kind of a short and sweet video lecture. So what is a hydatiform mole? So it's a mass or a growth inside the uterus at the beginning of a pregnancy, and it's a type of a trophoblastic disease. There's a benign form, which is non-cancerous, and there's a malignant form. Either way, it's not a viable pregnancy, right? So it's not a fetus. It's not a zygote. It's like a pregnancy, but it's not one. Okay. So let's get into a little bit more detail here. So I've added some pictures here of a complete molar pregnancy versus a partial molar pregnancy. And let me explain the difference. Okay. With a complete molar pregnancy, the placental tissue is not normal and no fetal tissue forms. Okay. It's the result of fertilization by a sperm, right? But the nucleus in the ovum is not, it's either not there or it doesn't get activated. So, in other words, most commonly a sperm and an egg meet, but there's something wrong with the egg. Okay. And specifically, it's at the 46XY chromosome, but you don't really need to know that. But the bottom line is the egg is not right, right? There's no nucleus in there, or the nucleus just doesn't get activated for whatever reason. A partial molar pregnancy sometimes has some normal placental tissue, but there's also abnormal tissue. So there may or may not be a fetus, but it's not going to make it, right? Usually that's the one that will miscarry early in pregnancy. And partial molars are triploid, which means two sperm or a two-headed sperm, which is even worse, a diploid sperm, goes and fertilizes an egg. So from the very moment of fertilization, it's not right. And it's like the body knows it's not right. So that one usually results in a miscarriage spontaneously. The body's like, this baby's not right. We have to get rid of this and start over. So that's the difference between a complete mole and a partial mole. Okay. So what are the causes? So it results from the overproduction of tissue that's supposed to be the placenta, but it's really not. It's not viable placental tissue. Older women over 35, double the risk. Over 40, they're 5 to 10 times more likely. So that's bad odds. And if you're under 16 and get pregnant, you're at risk also. And other causes are, during the fertilization process, like I said, if a two-headed sperm fertilizes an egg, from the word go, that's a problem because it's not going to result in a good viable pregnancy. Also, dietary nutritional deficiencies like low protein and vitamin A and fats are sometimes so people that are truly malnourished, that you see it very, very infrequently in this country, but in other parts of the world you see it more frequently, sadly. So the egg gets fertilized. It's a pregnancy usually, but instead of developing into a baby, it develops into just a group of cells, basically. Okay. Sometimes, if there's a miscarriage that's not complete or an ectopic pregnancy, it can become a molar pregnancy, right? So it's just the cells do not divide and grow the way they're supposed to. They are just all wrong. Okay. I've never seen a viable fetus come out of it. Usually, if there is a fetus in there, it's not viable and it's going to spontaneously die at some point, right? Because it's not going to be right. Okay. So the initial manifestations are symptoms. In the beginning, you feel pregnant, but the uterus gets big, larger than expected, and quickly within 10 to 16 weeks of the quote unquote pregnancy. You'll have a positive pregnancy test usually, but some vaginal bleeding, severe nausea and vomiting, right, will be there. And you won't have any baby movement or heart sounds. And sometimes these things that look like grapes, tiny grapes, will come from the vagina. So it's like a discharge / bloody discharge that looks like grapes. That is basically screaming of a molar pregnancy. And complications can happen if there's no intervention. So if it's allowed to continue to grow, at some point, It's not going to be anything more than this huge group of cells. So severe bleeding and hemorrhage with hemorrhagic shock, right, can happen. Preeclampsia, which then can cause seizures and hemorrhage. So it's not good. And so buckle up, because here's the picture. Okay. So this is a uterus that was removed from a real uterus, removed from a pregnant woman. And here's the inside of the uterus. Okay. It's big, right? Huge. Looks like a pregnant uterus, but then when you look inside, it looks like clusters of grapes, right? Just bleh. Okay. So there's no viable fetus in there. Symptoms, like I said before, abnormal growth of the uterus. It's usually bigger than expected. Sometimes, but rarely, it can be smaller than expected. Severe nausea and vomiting, vaginal bleeding, and those grape-like vesicles that pass through the vagina in the first 3 months. They literally look like little bloody grapes. Okay, those are your big warning signs that this is a hydatiform mole. And also the other symptoms would be symptoms of hyperthyroidism, like heat intolerance. They're always hot, diarrhea, tachycardia, restlessness, nervousness, warm skin, like kind of clammy skin, like sweaty, tremors, weight loss, right? All symptoms of hyperthyroidism, and symptoms of preeclampsia, like hypertension. There can be fatigue, shortness of breath, coughing, and the abdomen will swell as if the woman is pregnant. So it looks like a pregnancy from the outside, except with all these weird, bizarro symptoms. What is the treatment? You got to get the pregnancy out. So either a D&C, dusting and cleaning, or it's really a dilatation and curettage, where they dilate the cervix, go in and basically scrape out the contents inside the uterus, or a vacuum extraction, where they dilate the cervix, and then it's almost like a vacuum cleaner. It basically suctions out the contents of the uterus. If it was a malignancy, because sometimes these can turn malignant or cancerous, not only must it be removed, but there's going to be treatment following the removal that includes drugs like methotrexate or vincristine. These are chemotherapeutic or anti-neoplastic medications. And there are two medications that the board may ask about. The board loves to ask about methotrexate, sometimes vincristine, but those are two drugs that you need to know about. So they're both cancer drugs. When we say chemotherapy, we mean we're giving medications that are treating a form of cancer, okay? Anti-neoplastic means the same thing. Anti means against. Neoplasm is a new weird growth. So anti-neoplastic is an anti-cancer medicine or a chemotherapeutic medicine. And they have a lot of side effects. Anybody who's ever known anybody that's gone through chemo probably knows that symptoms like hair loss can occur, severe nausea and vomiting. And why do these things happen with chemotherapeutic meds? Cancer cells, carcinogenic cells, grow or proliferate much more quickly than normal cells do. Okay. So the medications that we use to treat cancer attacks quickly proliferating cells because they're usually the cancer cells. But fun fact, the only other cells in our bodies that grow almost as quickly as cancer cells are the cells for our skin, our hair, and our digestive tract. So the chemo attacks those, which is why you lose your hair and you're always throwing up. Okay. And then the other bad side effect is immunosuppression. So in other words, these drugs will suppress your bone marrow and make it impossible for your bone marrow to make red blood cells, white blood cells, or platelets, because all your bone cells all your blood cells are made in your bone marrow. When the bone marrow becomes suppressed, you have no ability to make white, red blood cells or platelets. So you're going to be immunosuppressed. In other words, if you are exposed to infection, your body is not capable of making white blood cells to fight it off. So in other words, a common cold could potentially kill you. Right. So the side effects of these anti-neoplastic drugs, methotrexate, vincristine, those are two you need to know. And generally speaking, nausea, severe nausea and vomiting, hair loss, right? And that's everywhere, not just on your head. Pubic hair, eyelashes, eyebrows, right? You can lose all of your hair. And of course, immunosuppression and anemia. Okay, so all these fun facts.
Miss May.
1 second before questions, because I'm recording. So that's the end of that recording. So let me stop recording. All right. And that's going to be the end.